Welcome to the CereCore podcast, where we focus on the intersection of healthcare and IT. From practical conversations to strategic thought leadership, let's unpack the decisions, challenges, and journey of those whose purpose is to deliver technology that improves healthcare in their communities. Well, thank you for joining us today. Today we've got Al Smith, Senior Vice President and CIO of Lifepoint, and based here in Nashville, Tennessee. So excited to have you joining us. Thank you very much.
Thanks for having me.
So, we always start with a little bit of an overview. So if you wouldn't mind, Al, just tell us a little bit about your journey as an IT leader in healthcare. I mean, you've witnessed some tremendous changes in the industry over the years and experienced, a lot of growth in a variety of companies that you've served. Tell us a little bit about what that journey has been like for you.
Yeah, I think it's been an interesting journey along the way. I don't know that I started out when I got out of college that I wanted to be a CIO, and I think your career takes you in interesting ways, but overall it's been a lot of fun and very challenging. I think one of the reasons, when I first got out of college, I worked for a consulting firm and had the opportunity to work in, 5 or 6 different industries: Department of Defense, public utilities, all over the place. And when I got to healthcare, I just liked it. It just felt good. And it felt good to be part of something that was a little more tangible than widgets, something that was, it sounds bad or a cliche, but sort of, something a little higher calling, helping people, helping patients, helping our frontline clinicians, give the care that we all deserve. So it kind of landed there. I kind of fell into it a little bit, but, overall, it worked out really well. So I think it's been an interesting ride. And I think part of what I've always enjoyed about healthcare is it's about as complex and as difficult and as interesting as you can possibly get. My attention span isn't super long. I can get bored with things, and I have found that I have never been bored in healthcare. And as my career has advanced and been the CIO through now multiple companies and mergers and M&A work and all this stuff, that there aren't a lot of dull days, and that fits my personality pretty well. So I think overall I ended up in the right place, and I get to do a lot of cool stuff. If you even look at the acquisition of Kindred Health back in January, now I'm learning about post-acute care. Behavioral health hospitals, different vendors, different business models, different billing. And I'm like, wow, I didn't even know some of this stuff existed. So it's been a lot of fun from that perspective, just to continuously learn and continuously be challenged to have to learn something new and fun.
That's it. That's great. And, I think for those of us who have been in different industries in the past, it really, when you get to healthcare, everything does change. Some of the underlying technologies might be the same, but the application, right? The end results of what we're doing is radically different, and that higher calling really does come into effect. And I think that's why so many of us, yourself included, stick around and stay and really enjoy and thrive in it. So I appreciate you sharing that.
I think it's something you can really, hone back in on when everybody has bad days. I mean, there are days everything's falling apart and everybody's mad at me and why isn't this work? At some point you can go back to why are we here? And it's back to the patient and a caregiver, which to me is a really nice thing to go back on. It's not, I'm producing a car, nothing against that, but I'm not producing widgets. It's something that's tangible, because at the end of the day, we've all been patients, right? So there's something you can relate to that's meaningful to me.
Absolutely. Well, let's pivot a little bit and talk a little bit about some of the leadership strategies or your lessons that you've kind of gleaned and gathered over the span of your career. Some of those are timeless, regardless of when and what you happen to be facing. Others might be specific to instances like, oh, I don't know, what's one that happened recently, COVID. So, what are some of those, kind of insights or tidbits that you've gleaned over the years that you feel like other healthcare leaders should really pay attention to and know?
Yeah, I think, COVID. I mean, we all experienced COVID, but I think those of us in healthcare experienced it maybe a little bit differently than many other people did. So I would throw out a couple things that that I like to always remember. One, we talked a little bit about resiliency. I had a former boss that used to say, keep moving forward. In fact, he used to say, stumble forward. Don't go backwards. You're not always going to be, running full breakneck speed, making progress. It might take a step back, but keep moving forward. And I think that's really good. And I think that's really good for anybody in IT. There are bad days, right? I mean, you look at cyber issues or upgrades that go bad. No matter how hard we work, there's something that's going to not go well. And I think just having resiliency to say, you know what, let's fix it, let's move on, let's learn from it, but let's just keep moving forward. So I'd put that one there. People first. I mean, you're only as good as your team. I know that sounds a little bit of a cliche as well, but you need to surround yourself with people that not only bring out the best in you, but also shore up some of your weaknesses. None of us are perfect at everything. And you got to find people that bolster areas that maybe you aren't quite as strong in. There's things I'm good at. There's things I'm not as good at. So find people with that. Find people with diverse backgrounds. I like people that will debate. I don't want a group of people that I'll go, yep, great idea. And then later you're like, well, that was a bad idea. Let's debate. Let's do it respectfully, but I think we get the best output when we have the right team, and the team needs to have diverse viewpoints. I think that's really good. But ultimately, I look at my job as I need to be working to eliminate barriers so the rest of the team can be productive. If it takes an hour of my time, but it frees up 6 people to be productive for a day, that's well worth my time. So I'd say that. I'd also throw in their leverage partnerships. I think I've particularly found that here in Nashville, you can't own everything, and you got to find strong partners that can do things that you're either not good at, you're not resourced at, you can't find the people, whatever it is, expertise. But find partners who can help you. As an example, we've had a long one with Tony and CereCore and Parallon, and there's things that they do really well that we're not good at, and I need to leverage them for that. And there's things that we are good at that we need to internalize. But don't be afraid of partnerships. You can't own it all, and you really shouldn't want to. So I think those are a few things I'd kind of throw out there. And then the last one I'd throw out possibly would be business acumen. Where I sit, I need to be a business person that understands how to apply technology, not a technologist. I find I do a lot of translating. I do a lot of interpreting, a lot of listening to try to understand what is it the business is trying to do? How can I help? And then how do I apply technology behind that? Technology is a tool. There's lots of tools, but it's a tool and a very effective tool for many things. But it's got to start with understanding the business.
That's right. No, all great points, and I think we could do a podcast on each and every one of those topics. They're really in depth, but I think that last one, that you talked about, the concept of business acumen, really flows into my next question for you, because it relates, right? And you mentioned it. Technology is an enabler, and it's part of it, but you still have to be interfacing with the other folks inside of the organization, and relationships are really vital and key to that. And some of the things that we ask our clients and our prospects, and we've done surveys through HFMA and Chime and various others, but it speaks to that collaboration. From a CIO to a CFO to a CEO, a CMO, so on down the line. Can you speak a little bit to just kind of how you all get on the same page? What that collaboration looks like, so that not only the business acumen raises in the IT organization, but the business acumen also raises across the organization as a whole.
Yeah. I think that's a daily work in progress, and every company could be a little different because the culture is a little different. But a few things that I try really hard to do. One is walk around, go find people, drop in, talk to people. It's amazing how many issues and potential areas you can help if you just ask. I think that's really important. I think another thing that's really good is be known for resolving issues and bringing value. Right. Strategy is great, but you got to be able to operationalize it. And at some point, if people say, you know what, Al's got a reputation of delivering the goods, so to speak, and can get stuff done that helps me, I'm much more likely to get invited to the table, so to speak. So you got to be willing to really roll up your sleeves and be known as for getting things done. And then I find a lot of those doors start to open up because over time people say, well, wait, he helped me last time. Maybe I should go talk to him. So those are a couple things there. I think in our case too, one of the things is I think it's always a little dangerous to stay here at the corporate office or what we call the HSC. We know what we know, but at some point you got to get out in the field. You can't manage everything from here. And it's amazing what you get a very different lens if you're talking to a CEO or a clinician in the field than maybe how we think it all operates. So relationships with the CEO and the CMO and corporate, absolutely got to have those. But relationships down in the facility, a CEO that'll call you and just say, this isn't working and here's why, and I need help with this. You can get a lot done that way as well. But some of that is you got to go meet them out where they are and see it. And then you bring it back and then from a corporate perspective, say, what can we do about this? The last thing I'll kind of throw in there is I like to call IT as a team sport. So I have my piece, but operations has got to be at the table too. So right. If I don't have those relationships and I can't get the COO or the division president or a facility CEO lined up, it's not going to work. So you've got to have them through all those levels. Otherwise, IT is just not going to work. I mean, people will eat technology for lunch unless you deal with the change management. You see it all the time.
Yeah, you're spot on, and I think it, some of it even comes down to just figuring out a common language, or learning some of the vernacular of how a CFO thinks, for instance, or how a clinician. So it's not only the day in the life of, but it's also coming that common language, so that you truly can communicate, and it speaks to what you talked about earlier, right? Elevating that business acumen. So whether it be dusting off the accounting 101 book, or maybe even taking an online course and clinical workflow, or you name it, to try to elevate and understand. I think it's certainly critical, particularly in our line of work. So
yeah, absolutely, I would agree. Now, but I would also say part of that is having the right team around you, right? So, absolutely. For instance, I have a CMIO. He knows things about clinical workflow that I will never understand like he does.
Yep.
So having a good team and knowing when to pull them in and say, look, I'm not the expert on this one. I can help facilitate, but I need so-and-so at the table because they know a lot more about rev cycle than I do.
That's right. Well, you hit the nail on the head there, Al. It's building those cross-functional teams in such a way that you have all of those elements at the table together working effectively. So no, that's great to hear. So you've led IT organizations and teams now for a while through acquisitions, mergers. You mentioned Kindred. You've managed a very, very complex environment, multiple EHR environments.
Yeah.
With obviously lots of moving parts and pieces. I think you mentioned earlier there's never a dull day, right? So what does that decision making process look like for you as a leader when you come to some of those pivotal crossroads? And what's that thought process involved?
Yeah, so I throw a few things out there. I mean, all of us try to leverage our prior experience. I mean, we do that by nature.
Yep.
But I found listening and understanding before we just apply it. I found a lot of times if you just say, I've done this before, here's what I'm going to do, you make mistakes. So understand every organization is where they're at for a reason. Even if you think it's crazy how they're organized or something, there's a rational reason why they're there. So, first try to understand, listen. I think that's always really important. So usually our due diligence process is a lot of questions, a lot of data gathering, not a lot back to people. Just I'm trying to understand. And then you can make some rational decisions based on data. Do you convert their EMRs? What do you do? I find that's especially important when you start talking about the human side, the teams, the organization. How do you redo that?
Right.
I would say overall, I'm kind of an incrementalist. And I'm not somebody who's usually going to go in unless I have to, for some reason, just blow it up and start over. I think that's usually not a good way to do it. Yeah, I mean, you can cause a lot of wreckage that way too.
That's right.
But go in, understand, and then start to figure out what's the best thing. Learn from what you have from the past. Learn from what this company that you're merging with or acquiring, they've got best practices. They probably do some things better than you do. You do some things better than they do. And the end product is to figure out how to blend that together. So now I will say I've made some mistakes along the way where I think you do have to have some what I'll call non-negotiables. And I'll throw cybersecurity in there. You know, you need to get pretty quick to this is the common set of security tools that we think best protects the new company.
Right.
And you need to get there relatively quickly. And you may have to be a little dictatorial on that. That's an example with cyber in today's environment.
Mm-hmm.
You don't get a lot of options. This is what we're going to go with. So you need to have some non-negotiables, but I find the non-negotiables are a lot smaller. They're a lot smaller than the negotiables. And let's think about this and what's the right way to do it. So those are a few things that are there. I think the other thing you brought up too is because we run so many different EMRs and different systems, you know, look for tools that are EMR agnostic. Why do you have to rip out the EMR? There's a time and a place to do that, but if you can wrap things around and make it better for your clinicians and more effective and maybe more efficient, do you really need to do that? Challenge it. Challenge sort of those assumptions that, well, we've always done this. Well, that's not necessarily the right answer. I tell my team quite often, if you tell me that's the way we've always done it, that's absolutely the wrong answer to give me, because that's not a rationale. Tell me why it applies this time, because it may not.
No, you're spot on, and I think that applies even, you know, what you talked about earlier when it comes to those, you know, non-negotiables and those sorts of changes. It comes back to that level of communication, right? People, for the most part, people are logical. Yes, we have sacred cows here and there, and sometimes we have to be drugged, you know, by our earlobes to make a change. But for the most part, if things are communicated properly, if they're communicated respectfully and you know, and logically, folks go, okay, I get it. Yes, I might not like it, but I understand. And you know, getting those folks on board to move is certainly critical, and it's easier said than done, but you know, it's certainly one of those areas that is must be addressed as when you go through those situations. So that's great.
Absolutely.
You know, you had mentioned it earlier, but you know, a little bit when you started talking about bandwidth, right? And you know, there's organizations can't just, you know, can't do everything, especially in today's given age. You know, maybe 10, 15 years ago, sure. But with everything going on from cybersecurity to business intelligence to you name it, there's a lot on the plate. And you know, you had mentioned that, you know, we've had a long-standing partnership, and I appreciate you mentioning that earlier. And certainly we have valued that for years, and look forward to more years to come on that, delivering that value. But you know, for those folks that are listening that are, you know, at that crossroads, right, where they've cut more than they can handle, you know, what are some of the guidance perhaps that you could give them, or you know, points of you know, kind of those check marks where they're doing their analysis to say, hey, maybe here's an area that we need to look at a partner, or no, this is something that you know, we should keep in house. You know, are there some of those, you know, checklist items that you could walk folks through?
Yeah, in terms of like, well, I mean, every organization is a little different depending on your strengths and some of your strategies, like what makes sense to outsource. You know, obviously there's things like help desk that people are probably more comfortable with, and things that might be a little more strategic, et cetera. So you kind of got to look at that. So is that the question, or is it more about how do you find the right partner?
Well, find the right partner would have been the follow-up question, but I think it's more along the lines of, you know, what are those things that folks, when they're in that position, need to look at, right?
Yeah.
I think you mentioned a few of them, which is, you know, internal talent. I think you mentioned some of the things about strategy. And so, you know, maybe if you could just touch on those just, you know, briefly to kind of give that logical flow of thought process.
Yeah. So, I mean, where my head goes these days is where do you look for partners? I think there are areas that jump out at me, like cybersecurity, some of the more technical skills where it's just getting harder and harder to get people and retain people. And I'm always really leery of, if I'm going to have an N of one on a critical team, that's risky, right? And if I can't get I can't afford two people or more, then that's a good one to look at, a partner who has scale, right? So if I come to somebody and they have 10 of X, if somebody leaves, we still have 9. Now, sometimes you pay a little more, but risk mitigation, I think, is always a good place to look at that, where you just need either skills, scale, something that says somebody else can do this better than I can. I think cyber is a great example of that, where I think all of us, it's kind of an arms race for cyber people. How do you combat that? If you have, it's just getting harder in those areas, and it's so critical that you got to have that nailed. And it's getting harder. It's getting more and more complex, where it's just difficult to find people that have all the skills. Now, we have a great cyber team, but I always worry about that and debate that with my CISO of, hey,
Sure.
is this sustainable? Can we keep this going for a long period of time? Because those folks are really in demand, and our folks do a great job. So those are probably the biggest ones that I look at: scale, risk mitigation. There's also places you can look that are more what I would call, for lack of a better term, a commodity. Help desk is a little bit easier to kind of outsource to somebody than maybe some other functions. So those are the ones that jump out to me of areas that we look at.
Oh, that's great. Any words of advice? You had mentioned it earlier on how to go about looking for that right partner.
Yeah, I mean, I think there's a few things that we kind of look at, and some of them are probably mom and apple pie, but you know, I think the term partner gets overused many times. A lot of people want to be your partner, but at the end of the day, they're really not your partner.
Yeah.
It can't be transactional. It can't be one-sided, right? A real partner shares upside and downside. There's times where, you know what, as a partner, you just say, look, I'm a little upside down on this, but in the spirit of the partnership over long term, that's great, and I'll make it up later. Um, I think somebody who's really down in the trenches with you, somebody that when it gets bad goes, I'm digging in. If I got to throw an extra person at it, we're going to make this happen. We're going to get through this. I think is always good. I think it's always good to have somebody who is a real partner. Debate should be fine, right? I mean, we don't always have to agree. At the end of the day, we need to lock hands or stack hands and say, this is the approach. But again, back to the comment I made about having a team around me that says, you know what, Al, you're making a mistake here. That's fine. As a partner, I think that's good. And then the last thing I'll say is sometimes a good partner says, you know what, this isn't for me.
Yep.
It may be something that the partner's never done. And they say, you know what, you need to go find somebody else. I think that's a good, honest communication. And I find a lot of times people are, well, but I could book some more revenue. But if you're not good at it and it damages the partnership in the long term, is that the right answer? And I think really good advice sometimes is to say, you know what, Al, this isn't in our wheelhouse. We can't handle it. Maybe you can bring another person along or another company along that fills that gap, but none of us are great at everything. And I think a good partner just admits that, acknowledges that, and is just honest about it.
Very true. Very true. No, great advice. Great advice. So, as we wrap up, I always like to look towards the future a little bit. So, there's so many things that are hitting us, and the buzzwords, right? You look at consumerism, you look at automation, and so on and so forth. What's from your chair? What are some of the next big things that healthcare IT leaders need to be prepared to lead their organizations through?
Yeah, there's a lot. I mean, there's stuff coming at us. It almost seems like every day there's another great idea, another vendor. And to be honest, some of it is the terms AI, ML, cloud. Some of the stuff is just overused or incorrectly used. Just it's almost like, well, if I say it's AI, he'll listen. So I think some of the challenges just as where in my seat is figuring out, kind of how do you weed through all of this stuff to say this one's worth spending time on and the rest is just noise. And I don't know that I have a good answer for that. It depends on the day. But when I look at things that are coming, when I look at innovation and we at Lifepoint are doing a lot more innovative stuff than we did historically in the last couple of years. And I really think COVID was the catalyst behind that, good or bad. If there was any good that came out of COVID, I'd probably say two, maybe work from home. For many people, that's one. The second one was got many of us to say, you know what, we've got to digitize some of this stuff.
Right.
Whether it's telehealth visits or other things. And we got some momentum. And I think part of what happened during COVID is we got a little bit more, I don't want to say this the right way, but we got a little bit more liberty to fast fail and to try some stuff.
Yes.
And we moved quicker and we made some mistakes and we retraced, but we made a lot of good decisions and did a lot of things and got a little bit more ability to try to innovate and try stuff. So I think that was good. Now you're not going to bet the farm and bet $1 billion on that kind of stuff, but little incremental pilots, and then can you scale those? I think were really good. But I think the big things, to answer your question directly, around, I'll put it under innovation. Now that's a big buzzword, but the big things I think here are new care models. How are we going to extend outside of the clinic, outside of the behavioral health hospital, outside of the acute care hospital? That's not where care is going to be in all cases like it was in the past. And we're going to have to meet patients where they are in their house, remote patient monitoring, what I would call telehealth, care anywhere, care everywhere, a lot of different buzzwords, but that's going to be a big focus. And those of us that figure that out are going to do well. And those of us who don't are going to get our lunch eaten by new entrants and other people. Because I think in the past we've been able to say, hey, I kind of dominate in a geography. Well, the internet doesn't know a geography. So suddenly that geography just started to break down. And now you've got new entrance into your market that you didn't have to worry about in the past. I think that's going to be huge, and to figure some of those things out. I think the other thing I'd throw out there would be artificial intelligence, and I'd throw sort of big data or analytics in there, but we're now capturing more and more data. And as we extend into the home, we'll have even more data. What do we do with it? How do we make data actionable at the caregiver side in the care processes, and or automate things and predict things that we couldn't do in the past? So in my mind, those are the two biggest areas. There's lots of others, digital patient experience, and big, analytics in general, et cetera. But I think those are the ones that are going to differentiate most of us, one way or the other, in the next few years.
No, I completely agree. And I wish we all had a crystal ball that was 100% accurate. I think there's certainly things that we can draw from, and you mentioned so many things there at the end, Al. Are there a couple of maybe go-to publications or places where you turn to for some of the what's going on from the latest and greatest that you would recommend for our audience?
Yeah, less probably publications. I think there are some trade shows that jump out. Gartner's, I think, one we leverage, and they do some great research. It's not perfect, but it's some really good research on a lot of different topics, and I think they've gotten stronger and stronger in the healthcare market. I'd throw that out as one. We also have now have a chief innovation officer and some people that are focused on looking at innovation. It's not a side job of, hey, Al, from 6 to 8 at night, can you research this? I think that's been helpful. We also belong to like the Heritage Group and some other people that do early stage digital investments early on. We're doing some of that through Lifepoint Forward as well. So I think all of those are really good things, because, if I look at like a Heritage Group, they're out there looking at this stuff all the time. So I can call them many times and just say, hey, Brian, you ever heard of this company? Yep. And I've looked at 3 other ones. Oh, great. What can you tell me? So I think those are really great. And then last but not least at all is just your peer group. I mean, there are probably 10 CIOs that I stay in constant touch with, and we're always shooting up, hey, have you ever heard of so-and-so? We just did a pilot, it's worked really well. Well, that is way more important to me and a much better reference than any of these other ones, because it's somebody that I trust. Somebody can call and go, okay, how much work was this? What did it really cost? Those types of things. And I think those are fantastic. So networking, I probably don't make enough time to network, and it can't be your full-time job, but man, there's a lot of power out there, and just learning from other people.
No, great advice. Great advice. Well, Al, really appreciate your insights today. As we wrap up, is there anything that we haven't got to that you just absolutely think that our audience needs to hear?
No, I mean, the only thing I'd probably throw in there is, enjoy what you do. We can't ever forget those pieces either, right? All these other things, you got to enjoy some of these things, or it's not worth it.
Right.
So hopefully along the way you can enjoy at least a good chunk of what you do and find some passion behind it. Those are important things.
Great advice. Great advice. Well, Al, thank you so much for your time, and appreciate it, and look forward to the next iteration of our journey together. And again, thank you so much for your time.
Awesome. Thanks, everybody.
Thank you. Thanks for listening to the CereCore podcast. If you like this conversation, check out our other episodes. Visit us at CereCore.net to learn more about our IT services, and connect with us on LinkedIn. At CereCore, we are healthcare operators at heart and know the difference that the right IT partner can make in delivering quality patient care 24/7. Let's help make IT better. Here's to the journey.